Hello everyone, I'm Dr. Ashish Reddy, consultant microsurgical andrologist, Andro9 Hospitals, Begumpet, Hyderabad. Today we are going to discuss about the causes of male infertility, what are the causes which is contributing to male infertility, and what are the commonest investigations which we do, and what are the treatment protocols available in this. So commonest causes of male infertility are one, sexual dysfunction, two, varicocele, third, hormonal imbalance, four, it is stress, five, the food habits. So coming to one, the first problem, sexual dysfunction. The cause of male infertility will be sexual dysfunction in this case, because the person who is having the infertility might not be having enough erection, which is helpful for the penetrative intercourse to take place. Second commonest cause is hormonal imbalance. This is the most important contributing factor for male infertility. Whenever the hormones like FSH, LH, testosterone hormones, estradiol or prolactin, these are the five commonest hormones which needs to be checked and which have to be in a normal range, so that you will have normal spermatogenesis. Always make sure these five hormones are absolutely within normal limits. So third commonest cause for infertility is varicocele, where varicocele is a commonest contributor for infertility, because at least 40% of couples who are having varicocele will have infertility. So if at all anyone has any doubt about varicocele, please get one scrotal Doppler done. So you will understand whether your testis has any varicocele. So this is the third most commonest cause. Fourth is stress. So the persons who are in lots of stress because of the work pressure or irregular sleep timings, or any other further contributing factors like pollution, environmental factors. So these are the commonest other factors which contribute to male infertility. So next commonest factor which we see is smoking and alcohol. So these are where the person who is a very chronic smoker, if he smokes more than 4 to 5 cigarettes a day also, that will definitely affect his motility and morphology. And alcohol will cause erectile dysfunction. So this again contributes to male infertility. So these are the five commonest causes of male infertility. So person who is planning to get pregnant, the first commonest test which we needs to get it done is one, advanced semen analysis. Why we say advanced semen analysis is, in advanced semen analysis we'll be checking your DNA fragmentation index with that reactive oxidative species. These are the two most important factors which will tell whether you get pregnant or not, or if you get pregnant and what is the chance of miscarriage in this. So advanced semen analysis. Second, followed by scrotal Doppler to rule out the size of the testis, to rule out cryptorganism condition, where the two testes might not come down or one testis might not come down. So this scrotal Doppler will help us to know the volume of the testis, to see whether you have any varicocele. So coming to next test which we need to do is hormonal profile. So hormonal profile, that common test which you need to check is FSH, LH, testosterone. In this testosterone, always check for free testosterone and total testosterone. Next contributing factor is estradiol and prolactin. So these are the five most important hormones which you need to check. So these three tests will tell you whether you are having any infertility issues. Now coming to the treatment plans. Whenever there is a significant when your hormone so if your hormone profile has any problems, if your FSH is high, so always remember FSH and LH should be always less than 7. If it is more than 7, that means your testis is not functioning properly. So if FSH is less than 7, it is okay, and your sperm parameters are bad, then we will do something called stimulation of the testis, which will increase your testosterone levels and increase your FSH, LH, and this will stimulate the testis to produce more spermatozoa. When you have a problem in your motility and morphology, you need to rule out whether you have varicocele, or you wear tight jeans or tight underwears. So you need to do so that you need to avoid that, so that the temperature inside the testis is maintained 2 degrees below your body temperature. So these are the two important factors. And now coming to the most important factor, if you have a bad DFI, DNA fragmentation index is above 15, That is when we start them on antioxidants, because antioxidants will reduce the DFI, and this will if the DFI is more, there is high chance that you might get pregnant, but you might get a miscarriage too. So this you need to definitely, if the DFI is high, make sure you start some antioxidants. Now coming to people who are having the problem of azoospermia. So azoospermia is a condition where the sperm inside the semen are zero. So this could be two factors. One, it could be one non-obstructive azoospermia and obstructive azoospermia. See, coming to obstructive azoospermia is the testis produces enough sperms, but the way to come out might be closed, or congenital absence of vas also might cause this problem. So this is a simple problem where we can relieve the obstruction and you can get pregnant. If the azoospermia is because of non-obstructive causes, if your hormones are too high, we will try to reduce that hormones by giving you steroids. If the hormones are low, we will start you on replacement therapy, where your hormones will be replaced and sperm count will become again normal. So at the end of the day, everyone should remember that to become pregnant, we always need one healthy sperm. It doesn't matter if your sperm count is low. It is the most important factor in a semen analysis is your proper motility and morphology. If the count is low also, you can definitely have a natural child. It is not important that you should have 20. The 16 million count is good enough to have a natural baby. It doesn't matter if you have more than 16 million or less than 16 million also okay, if your motility and morphology is fine. If you have any further doubts, please come and see me at Andro9 hospitals. Thank you.